All right, welcome. Welcome everyone, and thanks for coming. We are trying to start on time. We've got people on Zoom as well, so who's in charge? The people on Zoom or the people in person? Right?
Yeah.
Sorry, but you know, it's a symbiosis. Got a few that are
Absolutely.
Okay. Well, welcome to Health Walk-In for those of you who haven't been here, and thanks for joining us for the Pulse lunch. We have a great speaker today. This is a slide we obviously have up here for things we do in the community. These are the sponsors. These are the organizations that support what we do, including the luncheon today and hackathons and educational seminars, leadership seminars, supporting the Women in Science and Health Network for other organizations that we play a role in our community. So we're grateful to our sponsors, including THR, for their support to allow us to do these things in the community. When the core of our business is to invest in 10 startups every year, and that is underwritten by private investors. So that's a great way to create win-win situations. But my name was not on the title of today's talk, so my job really is here to welcome our speaker, Brandon Pope, and navigating strategy and innovation in healthcare systems is the topic. Brandon, let me read his official THR. He's Senior Vice President of Strategy and Market Development at Texas Health Resources, which is the largest healthcare provider in North Texas. And in his role, he oversees market development, intelligence, growth planning, consumer product insights. Brandon has spent his career focused on applying systems engineering principles and methodologies to health systems, including value-based care, quality, strategy, and growth planning. And he has a degree from Abilene Christian, and then also master's and doctoral degree in industrial and systems engineering from Texas A&M. So it is my great pleasure to introduce Brandon Pope, who also spent his beautiful Saturday with us here at the hackathon and together with Jay and their CMO. So that's when you see true commitment to innovation and to community, when you have leadership showing up for things where they don't have to. And THR is definitely for us and for all of you. So with that, I'm just going to give you this clicker here and hand it over. Thank you. Please welcome Brandon Pope.
Well, no, thanks very much for the welcome. You know, when Hubert was like, well, let me actually read his bio, you know, one of the things you think to yourself very quickly is, I wonder what I sent them up, but no, happy to be here, talk to you guys about a big topic that obviously we're not going to solve in the next 45 minutes, but all I have to do is share with you some ideas and perspectives, maybe some things you knew, maybe some things you didn't, and then definitely welcome some questions and we can have some dialogue. So in addition to what Hubert shared with you, I added a couple of quick notes. You know, sometimes those bios we share are pretty formal, but I just wanted to throw a couple of things in there just as a way maybe do some more relatable things. So I grew up in this area. I was telling Hubert I grew up down in kind of the south part of the DFW, down in Grand Prairie, Arlington. I live down there these days. So I have a family of 4 boys, but now I'm raising 2 girls, so learning a lot. And I always tell people I'm a procrastinator. It is what it is. And sports junkie, I threw that in there, says it's a great time to be in DFW sports right now. So anyways, Hubert hit on my education a little bit. I think maybe one of the things, one of the reasons that's a little bit relevant is that, you know, you'll run into a lot of different people that work in strategy and healthcare. Some of them have a little bit more of a guru feel to them than I do. I have a very almost like nerdy feel to it myself. You know, I have this kind of quantitative background. But I also have a non-clinical background, right? And I've never been a traditional healthcare like administrator in a sense like that. And so what that really means is that I have to find ways to collaborate with all those people, right? And I think that's one of the important roles that strategy has is like, I'm not going to be the clinical expert, the finance expert, the operations expert, the tech expert in the case of a lot of innovation happening in healthcare today, but I have to find ways to successfully collaborate with those people, right? Hear their ideas, understand how to evaluate them, et cetera. Anyways, but I got into healthcare. I mentioned here, Jim Rohack, one of my great collaborators over the years, was a cardiologist down at Scott and White Clinic, and eventually sort of was the president of AMA. And he was talking to me as an industrial engineering student down at Texas A&M about some of the big challenges in healthcare and health policy, and that kind of led me to get interested and found myself, here today. So I spent some time up at Purdue, and over at Baylor Scott and White, and now at Texas Health. So anyways, that's just a little bit of a background. So what am I going to hit on? Actually, let me go back to the title here. So navigating strategy and innovation. I'm going to talk about these things a little bit separately. Obviously, they're not completely distinct, but I'm going to talk about strategy a little bit. I'm going to talk about innovation. So just to give you a sense of the flow here. I'm actually going to start a little bit with I recognize that some of us may not understand what is strategy doing in any, company, right? So wanted to share a little bit of my thoughts on that, talk about what a strategy sometimes end up looking like in a healthcare system, some about my role and some of the things we're doing in strategy at Texas Health. And then I'll transition a little bit. So to give you guys a little flow. Sorry to hop slides on you. So this is a little bit of a wordy slide, but anyways, I just, one of the things that I always think about is, I don't try to reinvent the wheel where I think other people have really great thoughts. I think you can take those great thoughts and apply them in your business context or your healthcare system, whatever it is. And so some of the best people that I get clarity of thinking on about strategy. So Mike Porter up at Harvard for a long time has some of the seminal work in this area. He talks about some things that are actually pretty clear concepts, which then we all go, as we often do, and we sort of muddle them up for application of these things. But he really talks about strategy in a couple specific ways. One is choosing to do something differently than the competitors in your field, right? As it relates to innovation, a lot of times when I talk to companies, different things like this, they think they're the only one in their field, right, for one. And so I think one of the things to always try and have a clear sense of, which can be really tough to do, is, hey, objectively, what am I doing differently than my rivals, some of the other people in my field, and how do I think that's better, right? So he talks about choosing what to do, choosing what not to do. Differentiated, I feel like that's, there's a lot of buzzwords in every industry. This is for sure a buzzword, I feel like, in healthcare right now. Not that that means it's something bad to think about and aspire to, but I think it's actually challenging to assess what is truly differentiated, right? And I think there's a couple of reasons for that. One is that we all get personally invested in our ideas that we think are great, right? And that in and of itself becomes hard to then sort of step back and say hey, objectively, what is good and different about this? But the other thing is a lot of times we ask healthcare consumers, hey, what do you want, right? Would you do this? And that in and of itself is actually very difficult, right? I think about that from two perspectives. One is that people in general about anything, healthcare or anything else in life, they actually have a tougher time than you think answering a question, hey, what would you do, in a way that's consistent with what they actually will do, right? So that's sort of a fundamental thing. I actually think about it in healthcare, we have the additional layer on that as my answer to what I will do when I'm sick can be very different than what I do when I'm sick, right? Because being sick and having a diagnosis and other things is actually very different than when you're not and you're trying to reflect on, well, how would I behave? Okay. So a couple of things, strategic fit is about making multiple decisions or investments that harmonize together. And that's another thing that's it's not always clear if those things are and aren't harmonious, and doing something that's difficult to imitate. So anyways, these are not my thoughts, but things that resonate with me and that I try and apply, in my work at Texas Health. Another great thinker about strategy, you can go read a lot about Roger Martin. He has a good Medium post thread, and he kind of talks about you do a market assessment. This is a very classic thing to do in strategy is market assessment, know what's going on. Is my market growing or shrinking? What's my market share? All these different sorts of things. But he tries to really put a point on the most important question in strategy is what would have to be true, right? So if I'm saying that I'm going to do X and we're going to have Y results, really trying to think about that from the perspective of what would have to be true for me to believe that's how this is actually going to play out, right? What is going to have to be true for me to achieve these volumes and for me to move markets and create different things? And so that forces you, I think, to think about a couple of things, right? One is that the future has a lot of uncertainty in it. And we don't know, but it forces you to think about those uncertainties. And if things play out a certain way, how would that impact my business model or my idea, right? I think it also forces you to think about some of the counter sort of actions that may happen either because things in your own system change or other things in the market. So it's a very helpful question to ask yourself. So anyway, these are some more thoughts. I'm not going to read this. I want to keep moving. One of my favorite thoughts and help people think about regarding strategy is that a company strategy is observable, right? It's not like, I think sometimes we think about a company strategy as, oh, that's written down in the safe and locked up, right? It's like, no. The company strategy is what they do, right? But over time, right? You have to observe this over time. I put some examples on here. So I actually haven't seen Dropout. I'm sure y'all be shocked. I'm not currently a Netflix subscriber. But anybody in here seen the Dropout? Only one job? Okay, a couple. So the Dropout is about Elizabeth Holmes and Theranos, right? So Theranos, right, really burst on the scene several years ago, was thought to be able to revolutionize kind of the testing and blood testing industry. And anyways, a lot of that didn't come to pass. But I remember when I was at Photoscope at the time, but I was reading about some of the early excitement around this, and I went to my boss's office and I shared with him this article, and I said, hey, I think this is like maybe the next thing we should get in on this, right? And so I just think about that in retrospect now, because yeah, I mean, and maybe I was right or wrong, right? It didn't come out to be like that. And maybe now it's 10 years out or something. But one thing is to just realize, this is always a humbling thing, is what we observe and what we believe, like it takes time for these things to play out. I took a screenshot of a Becker's article about Tenet. Last week it was announced they acquired another 45 surgery centers, and they sold 9 hospitals. I would say their strategy has been very consistent over time, right? They've been selling hospitals and acquiring surgery centers. They believe in outpatient surgery as a helpful side of care for the future. So they've been very consistent with that strategy. And then, I'm sure many of you saw this like classic example last month, right? So I was talking to our chief marketing officer about, the post-mortem on how does this happen from a communications perspective, right? Or, within the span of 10 days, Walmart says, hey, we're adding all these clinics. And then 10 days later, it's like, no, actually we're shutting it all down, right? And so, anyways, we don't have to go into that, but I think one thing, and again, this is a true example. So when they announced, hey, we're expanding, and of course, DFW was one of the markets that they had really targeted for a large expansion. We were, I don't know to say scurrying around, we were really trying to analyze, where are those clinics coming? And are they going to impact our business? And why are they doing this? And we need to be worried about this sort of stuff. And 10 days later, that's not happening. And now, like, unleash the floodgate of everybody putting on their Nostradamus hat and saying everything they know about Walmart. So the reality is, we don't always know, and these things take time to play out. A lot of industries, Walmart, they're trying something, right? They hope to get certain results, but they're evaluating this over time. At some point, they have to change course with their resource allocation. So anyways, but I do think strategy is observable, just maybe not at a point in time always. You have to sort of chart it out. So that's maybe a whole thought. I just thought maybe a little bit helpful, in terms of strategy roles at healthcare systems. I worked in a couple of healthcare systems in a strategy role and relate to a lot of folks across the country. But some of the types of things you'll find people like in my type of role doing, right? So a big part of it, market analysis and intelligence, planning, right? So growth planning, capital planning, getting into some operational planning more as a partner, not an owner and a driver of that. Some, I don't know this at Texas Health, some strategy roles, they get into transformation management as the term that we sometimes use. A lot of that has to do with change management, right? Because there's a lot of inertia in the existing system, right? Not only in how we do things from a technology and people and process perspective. And if we want to change and do something different, you don't just walk in one day and say, okay, everything's different, guys, right? You have to go through a process to help people evolve that future state. Digital, product, and consumer. Product, I would sort of always disclose that's not a term that healthcare systems used a lot. I think 5 years ago, it's more of a tech term, right? And building product and we're shipping product, and it scales in a different way than healthcare system services traditionally do. That's a lot of things that healthcare system strategy roles get involved with these days. Payer and value-based care strategy, again, that is a little bit of a. You look 10 years ago, and there's been some long cycles in sort of value-based contracting strategy, but that's something that I think everyone recognizes. Look, healthcare systems need to be doing their role and being accountable for the cost and quality of care, and the different types of value-based arrangements and ACOs and the different things are ways that we try and do that. I think we've made some progress, though we have more to come. Sometimes when people in strategy kind of function like internal consultants, and that could be related to innovation, something like we're talking about today, or AI burst on the scene. And, not only is every startup, now AI, I saw this great LinkedIn post the other day. It was like somebody squirting, I should have put this in this presentation, but some like sriracha sauce on everything. And it was just like, they squirted it on the tacos, they squirted it on the rice, they squirted it on the box, they squirted it on the bag. And it was just like, just applying AI to everything, right? But AI obviously we think is going to be a big part of transforming not only the clinical care, the business operations, but I don't profess to be an AI expert. And so we're trying to figure out how do we partner with experts? How do we figure out the right places to incorporate this into our activities, other duties as assigned, right? So that's something that strategy is doing. I thought it'd be helpful for y'all to know, some of the things that people in senior positions at healthcare systems, I think, are thinking a lot about. I think a lot of these are true of both healthcare systems. I color-coded these in a way to represent that it's like, sometimes we talk about some of these factors influencing healthcare system strategies and what healthcare systems are doing. Sometimes you'll see these referred to as headwinds, right? So it's like, hey, these things are blowing up against us, against the ways we've traditionally operated. I tend to think of these more as just, a lot of these are externalities, and I think a lot of these will end up changing healthcare systems, the healthcare in the country for good. Though in the short term, it can create some disruption, right? How do we figure out how to work with each other? So a couple of things I listed here, right? So inflation and labor shortage, right? And again, these are not unique to healthcare systems, right? But labor shortage is a big problem. I think even more so relative to some other industries, right? Having the types of trained clinicians, all different levels to fill the roles, big challenge, right? So regulatory uncertainties, I always help remind people that healthcare is really a pretty heavily regulated industry, right? And I'm not weighing in on it purposely so or not. I think when I think about going to see a doctor or a hospital for myself and my family, I want to know that the facility is having the right standards and quality of care and the right external forces evaluating that. But there are a lot of uncertainties, right? So one of the classic ones out there right now is just related to telehealth, right? So we had some exceptions put in place during the pandemic, and those have been extended a couple of times, but the long-term future of that is not completely known at this time. Obviously, a lot of regulatory things going on in the last several years around women's health and all sorts of things, right? So those are uncertainties that cause people within the system to sort of say okay, what's going to happen? I don't know, maybe we need to prepare for both worlds, and that creates a lot of effort. I mentioned here increasing strain on the acute business. That may be a little bit of jargon that not everybody's familiar with, but I talked about the ASCs earlier, right? Well, as we've gotten better at taking care of patients and have better access to technology and understand, the lowest acuity site of care where we can take care of patients and perform surgeries in an outpatient setting. I got a picture of my dad the other day. He had cataract surgery, and my mom had told me he was having surgery. Well, she sent me a picture at 8:00 in the morning, and she's like, "We're already home." Right? I was like, "Well, I thought the surgery was happening this morning." It was yeah, the surgery happened at 7, we're home at 8. So that's great. One of the things that does is the patients that though can't be safely cared for in those settings, they still go to the hospitals, right? And what this does over time, you have typically older, sicker, more comorbid patients in the hospitals. And so it takes a lot of time and energy to care for those patients. And so that's a great challenge and responsibility, but it is something we spend a lot of time thinking about and how do we do that efficiently. Competition from disruptors. And again, I think of that as a positive thing. There's a lot of competition in DFW healthcare, and I think that's in general a good thing, right? It forces us to bring our best all the time. And so I think different types of innovative business models, some of those, like we saw at Walmart, may not stick, but some of them will, and some of them will have to figure out how to partner with because they'll provide either lower price or higher quality, and consumers will choose those models. I mentioned AI a little bit earlier. Our CIO sometimes describe our approach to AI as somewhere in between sitting on the sidelines and cliff diving, right? It's a lot of uncertainty, but we really recognize that this is going to be helpful and it's going to be necessary to get the outcomes we need. But understanding exactly how to do that, how mature is the technology, where's the risk, a lot of benefits. Maybe I'll just mention one other thing, that as clinical care continues to evolve, that will create a lot of unknowns that need to be answered. So, the GLP-1s have now come to the market, and even that one class of drugs is creating a lot of uncertainty around okay, well, who's gonna pay for these, right? Are the employers paying for them? What is Medicare gonna end up paying for it? And then how is this gonna change care pathways for patients? You know, are we gonna be doing less bariatric surgery in the future? Are we gonna be doing less of this? Is this gonna create more opportunities for patients to have orthopedic surgery because, you know, they can, they're not candidates for surgery? Well, GLP-1 is just one of like small, really class of drugs in the development pipeline. And a lot of these are very expensive, right? So it's going to create a lot of questions for us around how do we pay for all this and how do we reallocate resources within the system? So again, I'm not an expert in that area and certainly don't have all the answers, but there's some things that are coming down the pipe that we need to be thinking about. Okay, I'm going to talk a little bit more about strategy. Is there, Lindsay or Heber, is there a clock in here that I don't want to keep track of time? I can always do this. Okay. Yeah, thank you, Steve. Some of y'all are familiar with Texas Health more so than others. And again, you can go read this on our website. But one of the things I just want to highlight that I really, working at Texas Health, feel every day and believe that I highlighted in red here is just the mission, you know, to improve the health of people in the communities we serve. And so if you go read, for example, we have a document every year that's published called our social purpose report. It talks about some ways that we're doing that. And I can just tell you, you know, Texas Health makes significant investments in programs meaning to serve the health of communities in diverse ways. And that's not always, you know, giving people access to doctors and hospitals, right? It can be investing in food resources or educational resources in communities. And so I'm not going to belabor this. You can go read about this online. That's a real part of our mission and impacts how we think about strategy, right? So differently than other healthcare systems or other tech companies, or other things, this is always something we think about in every decision we make, right? So Walmart shutting down these clinics, I'm sure they're very invested in the health of communities, but that's a pretty big reduction in access of to healthcare services in those communities. And so when we evaluate decisions like this is something that's always part of our equation, if that makes sense. You can go read about this online too. The only thing I'll say about this is related to what I talked about earlier. You know, either closing down clinics, do you have hospitals, do you have ASCs? The heading of these say hospitals, physician group, in-person and virtual access, and then clinically integrated network. And so I think this is actually fairly representative of different areas of the healthcare system, which we're heavily invested in making, you know, access available to the communities we serve. Inpatient care, right? Physician care, in-person care at like an urgent care center, online services, virtual services, and then through our clinically integrated network with UT Southwestern and independent physicians to broaden the access in the community. And again, y'all can go find these online. This one, I actually wanted to share is something that's called our Vision 2026. I confirmed with our marketing guru, this is also essentially considered to be out in the public domain, but it just gives you a little bit of a glimpse. This document was set before I joined Texas Health, but there's a way that we sort of said, hey, internally, guys, what do we want to be focused on as we evolve our efforts? And so it's a little bit small, but at the middle of this diagram is the consumer experience and the care team experience. Okay, and so obviously the intention of this is saying, guys, we want to place that at the center and think about everything we do, which is a lot, right? Both in scope and scale, and always ask ourselves, how does it contribute to one of those key objectives? These channels, so here it says hospitals, retail, at home, right? Virtual, ambulatory, and aligned physicians. Those are different ways that we've kind of organized ourselves internally as key channels of which we want to deliver services that contribute to the consumer and the care team experience. And around the outside here, it talks about some capabilities that we thought were important to invest in. And I won't go through all of these, but there's everything from data and connectedness and consumer insights and investments in our people. So anyways, this is a diagram that maybe is one glimpse into our Texas Health sort of vision and strategy. It tells a little bit about what we've been focused on and how we've been organizing ourselves. Okay, I want to keep going. Transition a little bit, talk about innovation in healthcare. So first thing I did was look for a picture of innovation. So I actually used Microsoft Copilot. So on the Texas Health Network, we blocked ChatGPT, but we're a big Microsoft shop, so we've got access to Copilot, right? So I said, hey, Copilot, generate a picture of innovation for me. And it came back with this. which I thought was impressive. I couldn't have drawn this, right? And so you guys might want to encourage this to see the y'all's materials too. Correctly cited, we've got some flying cars here and some like hologram type things. At first, I thought this was like an alien, right? But I think it's just more of like more spaceship type stuff. So, anyway, so I think, one of the things about innovation is just that, well, what does innovation look like, right? I think there may be some wildly different ideas. I juxtapose that on the next slide, and I thought it's, put in two boats as like, hey, some of those impactful innovations that have happened in healthcare over the last, while have been things like this. And I don't know, some of y'all recognize this instantly. It's kind of one of the more famous like safety stories in healthcare. Is at one point we figured out that, hey, there's a lot of things running around, in a hospital room. Some of them have gases in them, some of them have liquids, some of them have things that we're putting into the patient, sometimes there's things that are coming out of the patient. So we should design these couplings to make them a little bit more error proof, right? To where you can only connect the right things to the right things. Otherwise you can have some bad outcomes, right? And so, and I think of this as like one of the coolest things ever, right? So, but I think I just want to juxtapose is like sometimes I think we get a little bit ahead of ourselves and we ought not to minimize some of the innovative opportunities that are before us in our day-to-day, right? Because those things can be hugely impactful, okay? So I think that's one of the things that if I was to tell people, and I know a lot of you, maybe you guys are in the startup community and different things like this, it's like sometimes our solutions look a little bit more like this, and our problems might be more easily addressed by things like this. And that's not to say don't shoot for this, it's just to help you guys understand the reality of kind of what happens inside the healthcare system. And we're very focused on solving, I guess, both of these things. The other thing that struck me as I was thinking about this, and Jovelyn shared with me some of the other presenters that y'all have in this Lunch and Learn series, is that, I think people might think about innovation in healthcare from a very different perspectives, but I kind of think of this as like the old, idiom of the six blind men feeling the parts of the elephant, right? Somebody was feeling the trunk and the tusks and the ears and the tail, and they all thought it was something very different, but in fact it was the elephant, right? If you're not familiar with that one, go check it out. But I think, if you're someone that thinks about the challenges in healthcare, some people would title those problems. I just think of them as kind of opportunities. You might have one view on what the innovation in healthcare needs to be, right? If you're somebody that's in the adventure community and thinking about where to invest, right? I might have a very different perspective on innovation and think about it more from like a business model perspective, right? What's going to scale and maybe give an ROI on some of the funds. Maybe you are an innovator, whether you think of yourself as like a startup, maybe you're part of big tech, maybe you're a traditional provider, but you're, trying to come up with a solution, right? And trying to say, hey, I've got something that could really make a difference. Why isn't this catching on, right? And then you've got, healthcare systems, kind of looking at it and saying, wow, we really need help with these major things that are challenging us. And so I think this is just something that I feel from time to time as people have a certain perspective, and it may be different. My perspective may be different from Lance's. And if we come to that point, we think, wow, we have really different perspectives. I'm not sure we can work together on this. You just realize we may be looking at the same thing from different angles, right? And so I think that's always helpful because, healthcare systems, for example, we have, I probably have emails, 20 things to do today. Well, I have time for 12 of them, right? So if you email me and say, I've got this great solution, well, you might be number 21, but I still only have time for 12. But anyways, I thought this was a thought I would just share with y'all. The other thing is that I struck out this wicked problems. And so that's a little bit of a niche terminology. You can go Google it and check out what that means. That there's actually some academic literature about what it means to be a wicked problem. But the whole point of it is that these problems exist for a reason, right? It's not like somebody has realized, well, there's a dollar on the ground somewhere. Why don't we just pick it up, right? Like these are generally tough problems to deal with, right? Because there's patients involved, there's clinicians involved, there's resources involved from people who are paying for a lot of this care or external to really the care process, right? So anyways, just that's something that I wanted to share with y'all is that a lot of these problems we're trying to solve are in fact very tough, right? And so that's something that's always helpful if you're trying to solve a problem is like, approach it with a little, an attitude of humility. I have to do that a lot in my position because again, I'm not a clinician. I don't know a lot about the clinical processes. I don't deal with a lot of patients on a day-to-day. So I approach these things from a very humble perspective and trying to contribute to the solution. So design thinking, again, this is something that we really try to bring to bear on a lot of the problem solving or innovation at Texas Health. Again, these are not my ideas, but things that we try and implement that I think are helpful. And I took a couple of examples here, right? This is not a class on design thinking, but two of the key things in design thinking on the left here is just balancing and appreciating the reality that there's some counteracting forces here, right? So this picture has these arrows coming from the words viability, desirability, and feasibility, right? So it's the idea that it's like, it's actually not that hard to find something that would be very desirable to fix, right? It's like, yeah, if I can fix this problem, everybody would love that, right? But you have to figure out like, okay, but how are we going to do that? And again, you might find it's like, well, I can do this, right? Or we can do that. Then viability too, right? So how is this a durable business model that between the who's going to pay for it can have some longevity? So that finding that balance is always something that I know people that have had successful startups before will appreciate. And then the diagram on the right is pretty complicated, but I think the whole point of it is that it's a cycle that has iteration to it, right? So it's, you know, recognizing that I'm not going to solve this, but I need a V1 solution to then get out in the field and prototype and test and get some feedback and iterate. So that's really the whole 2 points of this slide. You can go obviously read a lot more about design thinking, but I think the whole point is balancing these counteracting forces and then, you know, having an iterative mindset. Okay. This slide I put together trying to sort of do a meta-analysis on kind of like how innovation works from within healthcare systems, right? So what I tried to illustrate is that, you know, roughly you have on the left, you know, there's generally going to be some organic and some structured processes to advance innovation within the company, right? So there's always organic innovation happening every day, right? Nurses are at the bedside and thinking, hey, do I have a better way of caring for this patient? But there's also going to be some structured attempts within the organization to say, hey, you know, consumer experience is one of our priorities, that we want to find innovative solutions in the space. How can we allocate some resources to help advance whatever that may be, right? So I illustrated here, you know, there's a lot of different priorities that healthcare systems will kind of choose. One of the things they have to do is end up having to decide what are we focused on, right? Because you can't do everything, right? But clinical priorities, consumer-focused priorities, certainly efficiency priorities is a big part. And roughly, both that organic and structured innovation flows into, okay, the resources we have, right? Teams of people who work on these sorts of things. I drew 3 resource bubbles here. One says design, right? So like, okay, how are we going to design this workflow or this technology to solve this consumer problem that we've identified? The next is transformation, right? So it's one thing that I've designed my new solution, but how do I help get from where we are today to implementing a new solution, right? That's a big overlooked thing sometimes. And the last circle here is really technology. I put technology and AI, right? I just think it's a big part of what we do now. Y'all probably wouldn't be surprised that almost every new vendor request submitted, it's like, oh, we do this and we use AI, right? It's almost like if you don't put that anymore. And my perspective on this is that way. I don't know. My take is that, you know, I don't know if it'll be 5 or how many years, but at some point we'll just stop saying it. I just recognize that, like, it's just like the word software. It's like, well, of course this is software. Like, of course it has AI in it, right? So we'll see, but that's a big part, I think, of what we're trying to do is sort of match the problems and the priorities with the resources to move that innovation forward. And then at the bottom, I just said, look, you know, that is what it is. But something I talked about at the hackathon is, you know, I think Texas Health and every healthcare system really recognize that it's like, you know, we don't think though that Texas Health and the work that we do internally is going to solve things, right? It's like we really need to be partnering with the external community, sometimes with external companies, to really move this work forward. That's one of the reasons that, you know, we're partnered with Health Wildcatters, right? Is supporting the innovation in the community. We have some other partners with different types of organizations that do similar things. And then education, right? So educating both our people internally, but also sort of the communities around the opportunities, the methodologies that can advance innovation. So that's something we certainly spend a lot of time on. Okay, and then really the last thing I wanted to mention, and then definitely would love some Q&A, is the concept of just finding balance between, you know, sort of being outside the traditional system and inside the traditional system, right? So this book, Dual Transformation, some of you may be familiar with, but I think inspired some of the work, for example, at Ford, where they said, hey, we're going to create 2 companies, right? And Ford Blue is going to focus on one thing. And they basically bifurcated like the electric business from the internal combustion engine business, right? And the thinking behind that is they said, look, if we try to add these things together, the internal combustion business is going to eat the electric business, and it'll never get off the ground. It'll strive for resources. We'll tell everything no, and so it'll never happen. We need to create two separate companies, right? And there's obviously some merit to that. You hear a lot about this, right? The traditional system will say no to a lot of innovative ideas, right? That's a truth. But I think the balance of that, this article on the right was from Stat Health earlier this week, and it was trying to do their postmortem a little bit on, hey, Walmart is shutting down all their virtual services. You may have also read that Optum, right, is totally shut down their virtual services. And so what's happening? And one of the points they make in this article is, well, basically, those things were kind of just stood up as point solutions and made no attempt to integrate with the broader health system. And so what they kind of share in this perspective is that, look, the integrated solutions are really going to be something that carries the day, I think, in healthcare and innovation, because, I think integration is very important to healthcare, right? Sharing data, right? And sharing, collaborating between physicians. And today I'm seeing my primary care doctor, and then I need to see my cardiologist and my oncologist, and I showed up in an urgent care center, and how is all that connected, right? So anyways, the balance here is just, not being tied down by the traditional system and finding a way to get those innovative ideas out there and give them some air and some life, but also figuring out how to be integrated so that you don't, end up with the same fate as, well, we stood up this point solution, but over time, like it kind of withered on the vine because we never integrated it. So anyways, I think that's an interesting balance. And I'm not saying, I have that figured out exactly, but something just to keep in mind, right? So that's really, I think, the last slide I had, but we'll love some comments, some questions. We can have some dialogue here. Yeah, Greg?
Hey, Brandon, one thing that I've always seen, sometimes when I talk about strategy and solving problems, and you actually mentioned it, I think it never let the inertia. I looked at the medical system, this huge rolling stone, monstrous, this is a role, it's got to keep the inertia.
Yeah.
People come up with solutions and they go, I'm going to do this, and I say, you want to make a right turn, take half a degree or slow it down.
Right.
And there, when I see the problem, all the stuff I see, and say, okay, this is great, but it's possible to go along. You're going to innovate something. At least realize that, you just need to move a little bit.
Yeah.
Innovation. You cannot redo the whole thing. You're just wasting your time. But I see so many people, take that approach with their idea. Oh, I've got this to solve this thing. It's a great idea. It's not implemented.
Yeah. No, I think of it
You
as.
actually mentioned the inertia, which is unusual. We need to solve.
Oh, yeah, no, and again, so I disclose my background, right? I work in a large healthcare system. I'm also not from a startup background. I'm kind of this engineering type background. I kind of think of it as like the little marble that, bangs up against the bowling ball and eventually you get that thing swinging. But yeah, I think it's unrealistic that you're going to, that you're actually a bowling ball and you're, it's like create this collision course where you change the course of things overnight. Stephen, you had a question?
What's the most exciting, impactful innovation you've ever personally been involved?
Oh man, that's a tough question. Well, I would say some of the work that we've been involved with, in value-based care is some of the work that I've been the most directly involved with. So when you say directly involved, one of the things that I always, again, approach with a great deal of humility is, I'm not on the front lines dealing with, patients, and I have a lot of respect, deep appreciation for the clinicians who do. So, but some of the things that I've done, both at Texas Health and also in past lives, on actually holding, healthcare systems accountable to the cost and quality of care, I think is a big thing. Actually, Russ and I worked together for a while in an ACO, and so that was very real, right? It's so we were accountable to these quality measures, which were not just episodic. So for y'all's understanding, there's a lot of quality measured in healthcare on what happened during this hospital stay or this ED visit or this clinical visit. But really, what do we step back and say, what about the patient over this whole year, right? Did they have their hypertension screening? Is their A1C controlled? Did they have their breast cancer screening, right? What was their hospitalization rate, avoidable ED rate across the year? And so I think advancing some of those outcomes is something that I feel pretty passionate about. But I would say one of the things we always underestimate is that, okay, I work in strategy innovation at Texas Health. I'm a fractional part of the work, not only at Texas Health, and Texas Health is a fractional part of the work that's happening, across the industry. And I think one thing that, so being a non-clinician, but working in a healthcare system, I kind of have this interesting dual perspective on like, I didn't appreciate before I worked in healthcare, like the breadth and the depth and the complexity and the amount of things that are going on, right? So I was being educated the other day about all the maintenance protocols that are in place for all the different devices and pieces of equipment in a hospital, right? You don't think about this, but all those things have to have specific maintenance schedules with them to make sure that when the patient comes in and needs to use that, like that thing is ready to go, right? And so it was being described to me and I was not overwhelmed, but certainly impressed by it. It's like, wow, I didn't have the appreciation of the complexity of this work and what it takes just for the standard of care today to be delivered. Sorry, I was rambling a little bit in response to your question. Yeah. Yes, sir.
You touched on it a little bit, but what do you talk to your strategic direction regarding the home health?
Yeah. Well, I think, so Texas Health, this is actually, I think, an area where, to Stephen's question, like, I'm really proud of the work that Texas Health invests in this area. I think so, we provide virtual care to patients at home, both from our primary care and other medical group providers that are employed by Texas Health, but also from our urgent care centers. You can go get a urgent care visit at home through somebody there. We have a partnership with a company called Dispatch Health, which kind of provides acute care at home. We have a couple other sort of home-based service lines, but I think it's something that we realize is really convenient, sometimes almost necessary for patients, right? So, depending on where you live, getting to, clinic or other things, has some challenges. And so I think it's something that we'll continue to see evolve. These, I was describing to people, hey, Optum shut down their virtual service, right? What does that mean, right? Well, virtual visits have gone down a lot, right, from the peak of the pandemic. And so I think what's happening is this realization that it's like, well, it's sort of the augmentation of both in-person care and virtual care that's probably end up, we'll see where we end up in terms of what being optimal. But I think it's going to have to take a blend of both, because I think we're realizing that some people have a preference for in-person care. There's other reality of like where we are today in terms of measuring people and integration. Like there's a lot of things you can't do with a patient, via a video visit. But I expect us to continue to see different types of care models evolve. Infusion therapy at home is something that's being tried out in some different markets. So I think it'll be continue to be a focus, but I would really look for the balance of in-person care with sort of home-based care. Interested that response?
Yeah.
What's your experience or perspective on it?
But working with a lot of home health and,
Yeah.
I look at, more and more services being done in the home.
Yeah.
And, where is that going to be in 10 years? Things that used to be done in the hospital, whether it's dialysis or infusion therapy.
Right.
It's going to create a need for different clinicians and skill sets to be able to go into the home and care for those. And with the aging population, of course, everyone wanting to stay at home, which versus move to a facility. See if you can change.
DFW, of course, these are national problems. DFW has an average younger population, right? So we've got a lot of aging ahead of us, right? So between the aging and the growing of the population, we're gonna have to find places to care for all these patients. So, but you mentioned it, but you can be a hospitalized patient today at home, right? So Texas Health has this program, a couple of other healthcare systems do, but they'll come to your home and set up monitoring equipment and devices for you to communicate, virtually with your care team, and people will come by and check on you. And so we've actually had a lot of growth in those services this year. And so that's pretty exciting. And this is not necessarily, I was talking to people that do this program. It's like there's patients with low risk heart failure, other sorts of things that you're like, wow, you care for that patient at home. It's like, we're trying to find the best protocols, right? Realizing that, like you said, hospital beds are scarce and they're really expensive to build. And so figuring out the best way to do that is a big challenge and opportunity for us.
Good, thank you.
Greg, let me hit this one in the back. I'm looking back to you.
So are you seeing, especially with the rise of AI, are you seeing a lot of move towards predictive type activities that you guys are embracing?
So I'd say, so predictive, so I worked in the analytics space before I kind of transitioned to role of strategy. And so, predictive analytics, I feel like really sort of like predates AI, certainly. I think AI will be able to even advance sort of algorithmically and sort of accuracy of prediction of things. But yes, implementing sort of algorithms, say, hey, based on this patient's data, we can in real time predict their risk of sepsis, and at the time of discharge, predict their risk of being readmitted and ED. And so we might need to apply some additional resources or intervene with this care protocol. That's for sure a big push and a big opportunity. I actually think short term, some of the applications we're seeing where AI will have a bigger impact. One is on more of like, frankly, administrative tasks, right? So think about adjudicating claims and prior auths and a lot of these things that are actually relatively standard business rules that we just spend a lot of time passing things back and forth. So I think that's a big opportunity. You hear a lot about ambient listening and scribe documentation. There's some trials going on right now about, can AI help generate responses to in-basket messages? So I don't know if y'all message your doctor via your whether it's my chart or other application. Sometimes I message my doctor. I always feel really bad when I do because I'm like, man, I know how busy you are. But I have this. Go ahead and ask anyways. But the number of in-basket messages is, going like this, right? And so clinicians' time is going like this, right? So how do we make their time more efficient? So I think that's where a lot of what AI can do very differently than some of the predictive algorithms that we've had for, years now is like text analysis, generate their response, have a human in the loop to validate it, but then that can be a big time saver. So I think that's where like some of the generative AI is very different than the predictive stuff. The predictive stuff's been around and very important, and the PCCI guys have done a lot of that work pieces. And so we've got a pieces pilot going on right now. So I think yes, but I think when I think AI, I think some of those other use cases more so than predictive. One of the things I always tell people about predictions is your predictions are generally only valuable if you can make a different decision based on the information that you're being presented with, right? So we used to always, when I was working in the value-based space, we had these vendors that come in and say, hey, we have a whole library of predictive models that we can deploy just on your data overnight, and you'll have 200 predictions of all the things that are expected to happen to this patient over different points of time. And I think to myself, I don't know what I'm supposed to do with all that information, right? So I think that's the real balance with predictive analytics is like finding the balance, like, hey, if we had this prediction, I would have made this different decision, or I could have applied these resources sooner, and we would have really had a net better outcome. And so that's something we'll still have to find the balancing act of. I think about the most useful prediction I look at every day, right? Is it going to rain? And if it is, then I'll act differently. I'll take my umbrella, right? Like a really simple decision of linking the prediction to the decision and the difference in the outcome. Greg, I told you this. Yeah.
Quick, you mentioned a little bit about the drugs. How do you see going forward, how the new drugs coming out impact, not so much healthcare, but the cost of healthcare? For example, I remember when gallbladder surgery was like so common when I was a kid, my neighbor was doing it left and right, came out with a gallbladder, they basically dissolved, all of a sudden the drug just disappeared overnight. And I think that was a huge improvement. I call that more of a destructive type thing. What do you see in terms of drugs like that coming out? Not the high price cancer drugs, those are different, but the ones that will do something like that.
Yeah, well, as a post gallbladder surgery person, maybe I should have known about those drugs. No, I mean, I think those are things that everyone's excited about, right? So like you said, there's going to be some drugs that are like, hey, this is a net new part of the expense of healthcare, but it is sort of state-of-the-art therapy, and we can extend people's lives. And those are the ones where you have to struggle really with cost benefit analyses and all those sorts of things. But I think, yeah, to the extent we've got therapies that can, fundamentally change, is like, no, we used to do this procedure, but now, now we've got this, whether it's a drug or some other way of treating those things. I think those are going to be the wins, right? So, I think that's where we partner a lot with our clinical leaders, right? They have a much better bead on the reality of this being addressable this way and what's coming down the pipeline. But I think those are the things that we should be excited about. Yes, Steve?
How long do you think before we have a prescriptive technology? If these conditions are present, this is the course you need to take.
Yeah. So, we have a lot of that today. There's, sort of standards. I think one of the things that we're all realizing, though, is a lot of those standard pathways were developed based on the average patient. And the reality is none of us are the average patient, right? So I think what we're going to try and see is a real differentiation of those care pathways, right? More you hear about personalized medicine, genomics, things like this. But I think those will take time to develop. And I think one of the things that's sort of intertwined that makes that very complex is not everybody's preferences are the same, right? So going back to this example that Greg mentioned about gallbladder surgery. So I had, some stones. And so I asked people, what should I do? And I got like 4 different answers, right, about what I should do from physicians, by the way, right? Including one of them who told me it was their life's goal to never have surgery. I said, well, I don't know what that means for me, but some people said, well, you should wait it out. Some people said you should have the surgery. And so I don't know that, so what was my personalized pathway? Well, I don't know, kind of right, and my risk tolerances and what I want, sort of be happening. And so I think we're going to see that. My perspective on it is, like I said, I think a lot of one of the things that's tough to balance is standards of care and personalized medicine, and realizing a lot of the personalization is things beyond, sort of best practice medicine and can get into personal preferences. So I think that'll be a super delicate balance. It'll be good overall in time, but it won't be like, oh, we'll figure it out. Like, are you A, B, C, or D? And I will tell you what to do. I think it's not going to be quite that simple. So let's have some questions from over here.
Hey, I would love to understand how THR is thinking about women's health broadly, and are there any sort of things in the pipeline from your perspective?
Yeah, no, absolutely. Yeah. So women's health is a super important, part of obviously care and part of the healthcare system and delivery today. So maybe I can talk more about it offline, but we've got several projects which involve both care, like in the delivery part of, women's health journey, but also some parts of journey, like immediately after care and longer term in life, sort of prenatal care too. And so there's a lot of different innovation in that space happening, including a recognition, I think, that we have in this country, and it's true of DFW too, a lot of variability in outcomes, and those are variable across not only facilities, but different types of socioeconomic backgrounds. And so how do we address those things? It's a big priority for us, and a lot of innovation in the community. So I'm happy to connect with you offline, share more specifics about some of the things we're doing. You have a question?
I wanted to ask more about, you mentioned earlier in your talk about AI into healthcare efficiency. And so a project that I'm working on currently with a company out of New Orleans is basically developing an AI model that's capable of reading electrophysiology results.
Yeah.
Recognizing those sorts of graphs. And I was wondering about, from the health perspective, whether there's that in the medical industry. For example, patients are constantly being monitored, and a very well-trained nurse or doctor can just take one look at what the recording, EEG recording or something is, and say, oh, this is what's happening. And I'm wondering if there's an integration for AI in that system, so that it's not running around as much. Yeah,
there's a company called Clearly that you might want to go read about. I think they had one of the first FDA approved AI algorithms for reading CT scans. So I think we'll see this type of thought coming out, right? Especially related to images and other types of data. These are the types of things that AI is very amenable to training and identifying things that, while clinicians are very good, it's a matter of not only maybe could we improve the accuracy, right? That has to be validated, but mostly could we improve the efficiency, right? So give them a starting point and increase the amount of work they can do. So I think we've seen evidence of this already sort of catching on. That FDA thing is where the regulation in healthcare sort of comes in, and hey, we've got an idea, we can do this, but how do we validate it? And that's super challenging. But you guys are right on. I imagine we'll see products come to market in that space. Yeah.
Just for curiosity, how far out do you look with your innovation pipeline? I work with a lot of startups, Silicon Valley, love to fail fast companies, but obviously in this market, there's risk and viability to the chart. So a lot of smart people, millionaires, pushing that bowling ball. At what point are you willing to engage in concepts, trials, and things like that, when you're thinking about not just today, but the big problems?
Yeah. Well, I'm not an expert on sort of the cycle of startups and from pre-seed to A, B, and C and these sort of different things. But how I think of it is, Texas Health, has a big existing commitment to the care of the communities. And so, right, I read an article last week about there was a healthcare system that bought, I can't remember what type of company it was. I think it was a telehealth startup, and they bought it for $300 million. And then they recently sold it for $100 million. And I was thinking to myself, wow, I sent it to some people like with a wow, and like, I, personally found it almost like reprehensible that like, wow, there's $200 million that could have gone to care of the communities, right? So my personal perspective, this probably isn't necessarily a vetted perspective of Texas Health, is that I think healthcare systems have a really important role to play, but probably the primary role is not in that like high risk part of the startup phase. It's more in trying to leverage the scale, right? And the volume of care that we're delivering and the variety. It's like, hey, if you have a product that can solve problem X, we're likely facing problem X, right? And so I think that's an important and interesting role of healthcare systems is, being when they're appropriately vetted, so maybe some testing grounds and giving feedback on ideas and things like that. And then my personal perspective is maybe not trying to dip into the high risk part of innovation of startups, which we know is there. But also having a balance. You mentioned like how far do you look out, right? And I think of it as like, hey, we've got to realize we've got to deal with today's problems, but also let's look at the problems on the sort of 1 to 3 year horizon, and then also be thinking some about what's even further out. Because I think if you get too focused on solving like today's problems and not worried about what's coming down the pipe, then like as dynamic as things are, you'll get your lunch eaten at some point. Let me look at the clock. So we got like one more question, Craig.
Are you looking at virtual nursing? And if so, do you have any pilots in place?
Yeah, absolutely. Yeah, virtual nursing, there's a whole task force on virtual nursing. Actually, one of the most successful, piece of work in virtual nursing that's been done, led by a colleague of mine, May, is on virtual sitting, right? So, this is another thing that I think, clinically, like people like myself, you don't realize like, well, how many hours are healthcare systems spending on sitting? And that terminology is not familiar to you. It's like some patients are at a significant risk of fall to the point where you need somebody sitting with them in their room to make sure that we have, avoid that adverse outcome. But now they have, this is where AI is in play with this, right? Again, AI, I think, when this company was started, I don't know if they called themselves AI, but now it's AI, right? There's a camera in a room. And what they do is they defined a boundary box around Russ. And it's like, hey, as long as Russ stays kind of in the middle of the bed is like a concept, right? That, okay, that's fine. And what we can do, we can have somebody remotely monitoring Russ and these 10 other patients that are in hospital beds. Or obviously, if I'm an in-person sitter, I can only see one patient at a time, right? So how do we scale that? That's been a really successful pilot. There's a lot of other things going on in virtual nursing.
There's one online question from Banks Blackwell, and he's asking, Brandon, could you provide some insights into how Texas Health views new competitors in the primary care sector and how those competitors are affecting referrals?
Yeah, well, I would say one thing that is well documented is that there's a shortage of primary care, right? Not only true across the country, it's actually, I think, exacerbated in Texas because, as y'all know, we've been growing a lot in DFW, and so we haven't always kept up with the delivery of care. And so I think innovations in primary care are needed to come to market. My perspective is a while ago, we might have thought of primary care as more of like a point solution. And I think one of the things we're seeing now is a little bit of a differentiation of services in the primary care space. So you see some people are focusing more on like, you might think of concierge space, more like some people are more really tapping urgent care these days as like a primary care provider. And then how do we allocate our primary care physicians and APPs on the patients that really have the chronic disease, which need a more of a management cycle. And so, yeah, we think those, innovators are needed to come to market and again, address the big shortage we have in primary care and DFW in the country.
All right, well. Running remotely as well, and thanking Brandon for being here. Thanks, Brandon.
Yeah,
making yourself available. I don't know if you have to scoot off by the way, or you still.
Yeah, probably have 15 minutes.
Got a few more minutes. If you need to share some incredible innovation, absolutely implemented immediately at Texas Health Resources. I think that's the real reason he's here. This is what friends are for. And thank you online for joining us, and thank all of you for joining us here in person as well. And with that, we'll just release him to all these great opportunities.
That's right. Thanks, y'all.